So good afternoon. Today we're going to be making an announcement on testing in schools to help more students return to the classroom. But first I want to give an update on the Commonwealth's COVID-19 numbers. Yesterday the Department of Public Health reported 7,136 new cases. That was on 108,412 new tests, and over 11.4 million tests have been administered. 2,386 patients are in the hospital being treated for COVID, and 455 patients are in the ICU. We're in daily contact with the Commonwealth's hospitals to make sure that they have enough capacity to treat both COVID and non-COVID patients. I'll also give a quick update on vaccine distribution. As of the end of the day yesterday, over 345,000 doses of COVID vaccine have been shipped to providers in Massachusetts. 167,084 doses of vaccine have been administered by Massachusetts providers, including over 16,000 doses that have been administered by the federal long-term care program. As a reminder, these numbers are likely higher as there is a delay in the reporting by providers into the state's MIIS system. Phase 1 of our distribution plan is well underway, and on Monday, vaccination of first responders will begin. Local boards of health have established 119 vaccination sites where first responders can get a vaccine, and the command center is also working to set up several mass vaccination sites, and we'll have more to share on those sites next week. On Monday, vaccinations will also begin for residents and staff at assisted living residences, rest homes, continuing care retirement communities, and congregate care programs through the Federal Pharmacy Partnership Program. And on January 18th, we'll begin vaccinating congregate care settings that are not part of the Federal Pharmacy Partnership Program, and we'll have more to say about that next week. We know that the vaccines can't be administered fast enough, and the Command Center and DPH are working hard with our federal and local partners to vaccinate residents as quickly and as safely as possible based on the guidance and the rules that we put in place to ensure that vaccines go initially to those populations we consider to be most at risk and most important to our ability to continue to provide health care to people here in the Commonwealth. And we'll obviously continue to keep the public updated as we work through our priority groups. As many people know, in June we released detailed guidance for schools that was developed by medical experts and endorsed by the Mass chapter of the American Academy of Pediatrics to support safe in-person learning for all students. The Commonwealth also invested nearly $1 billion for schools to cover COVID-related expenses. There's now an overwhelming body of scientific research that shows that in-person learning can be done without spreading the virus, regardless of the community transmission rates. One needs to look no farther than the parochial schools here in the Commonwealth. 30,000 students, 4,000 staff, been open for in-person learning since August, with very limited impact associated with COVID. And most of those schools are located in communities with high transmission rates. It's a great success story, and I applaud them for it. As a result, many districts have been able to bring students back into the classroom. But unfortunately, too many kids remain learning remotely or in complicated hybrid programs. The teams at the Executive Office of Education and the Department of Elementary and Secondary Education have worked side by side with the Department of Public Health and the Command Center to help schools get kids back into the classroom. This includes rapid response mobile testing and Abbott Binex Now rapid testing, which began in December in more than 100 school districts. To help our schools bring more kids back, our administration's education and health experts will make weekly COVID-19 pooled testing available to all schools and districts across the Commonwealth within the next month. This is something people have been working on for months. And all of these people up here will have more to say about it in a minute. The data around this is clear that in-person learning is essential to kids' education, developmental, and emotional well-being, and we've shown we can control the spread of the virus in classrooms when the right steps are in place. This new pooled testing resource that we're going to be providing going forward will give districts the ability to bring more kids back to the classroom. Pooled testing increases the number of individuals that can be tested using the same amount of lab resources as a traditional PCR test, and this tool will help schools quickly test students and staff, helping to find and isolate any cases of COVID. Secretary Sutters will share more details on how the pool testing works shortly, and in the coming days we'll work with school districts that want to participate to bring more kids back to the classroom. Commissioner Riley, who's also with us today, will provide more details about how schools can volunteer to be part of this new testing program. We're grateful for all the hard work that so many of our staff and teachers have put in and day out to go above and beyond serving students and their families. And we've asked a lot of folks as we all work together to stop the spread, but children, and especially high-needs children, have borne the brunt of this terrible virus as their lives, routines, and educations have been upended. Pooled testing will provide additional safeguards to stop the spread and give students, parents, teachers, and staff confidence that it is safe to be in schools. And this new testing will give school officials more knowledge about what's happening inside their buildings every day. There's no doubt the virus will be with us for a while, and while there's a light at the end of the tunnel associated with the rollout of vaccines, we can't wait for everybody to be vaccinated before our kids get back to school. We look forward to working with everybody to implement this initiative. And with that, I'll turn it over to Lieutenant Governor Polito.
Thank you, Governor, and good afternoon. I'd like to detail a new program run by the Mass Life Science Center to increase testing capacity here in our Commonwealth. Today, we are announcing more than $1.5 million to support 4 projects to provide alternatives to current testing stopgaps, expand testing locations, and provide further validation of tests already available. These funds will be made available through the Accelerating Coronavirus Testing Solutions, or ACTS, which is the program designed and administered by the Mass Life Science Center. This program will help identify innovative solutions to expand testing in the Commonwealth in order to provide new options and opportunities to testing centers while reducing their costs for administering and processing tests. You should think about this like the MERT program, the Manufacturing Emergency Response Team that was assembled to make PPP here in the Commonwealth. The ACTS program will support projects focused on 2 core areas: accelerating the development of simpler, faster, at-home and point-of-care testing methods, and identifying new and innovative solutions that address existing supply chain bottlenecks. The 4 ACTS awardees that will administer projects are 2 Massachusetts-based companies, Cafera Diagnostics and Virix Health, as well as 2 of our leading research hospitals, Beth Israel Deaconess Medical Center and Brigham and Women's Hospital. As we continue to work together as a Commonwealth to overcome the challenges created by this pandemic, as we said before, testing remains essential to our fight and recovery from COVID-19. We look forward to working closely with these organizations, and I want to thank the Mass Life Science Center, led by new President and CEO Ken Turner, for spearheading this effort to fund projects that address these persistent challenges and support our recovery. As life science companies and institutions across Massachusetts continue to play a key role in our fight against the virus, the Life Science Center's mission is more important now than ever. In addition to the jobs and growth driven by our leading life science sector, the industry has stepped up during the pandemic to produce essential goods, devices, and therapies to treat patients and save lives. The investments made through the ACTS program will support the efforts of more of the cutting-edge organizations throughout Massachusetts that are ready to support our fight against COVID-19. We need as many tools as possible to win this fight and remain committed to providing the resources necessary to expand access and capacity for testing as we continue to work toward recovery. Thank you, and I'll now turn it over to Secretary Pizer to talk more about school testing.
Thank you, Lieutenant Governor. Governor, good afternoon, everyone. I'm excited to be here today to announce this new initiative to provide schools and districts with access to frequent, affordable COVID testing for their students and staff. Universal weekly testing will provide an additional tool for bringing students back into their classrooms. But I want to reiterate what the governor has already said this afternoon. As schools across the Commonwealth and around the world are demonstrating, and as the medical experts have confirmed, when the standard health protocols are followed, schools can be very safe places for children and staff, even without universal testing. Nevertheless, we all understand the anxiety that many people feel, teachers and parents alike, about returning to classrooms in the context of the current levels of COVID that we're experiencing now this winter. Today's announcement is intended to directly address those concerns in order to keep schools open and to help reopen those schools that have been closed. This pooled testing initiative builds on several other steps that the administration took last fall. Besides providing access to stop the spread testing centers in communities with high levels of COVID, the Command Center has been providing schools with on-site rapid response mobile testing in cases where there has been a suspected cluster. More recently, we have distributed Abbott BinaxNOW rapid test kits so schools can administer real-time point-of-care tests to students or staff who present symptoms while they're in school. Due to technological advances as well as the development of new cost-effective test techniques, we are now able to take our testing program to the next level. Specifically, the technology around pool testing has improved to the point where it is now possible to accurately evaluate 10, 20, or more swabs in a single batch. Local labs have also come online that are more capable of expanding capacity to deal with a significant increase in volume, which will be required to implement this level of testing across an education system of about 1 million students and staff. And finally, several promising pilot programs are up and running that demonstrate this type of school-wide and district-wide testing program is operationally feasible. Equally important, thanks to the recent enactment by Congress of the Phase 4 stimulus package, we will soon have sufficient funds at both the state and local level to implement an effective statewide program. Now that the conditions are right and the resources are in place, we are prepared to make a significant investment to get universal school testing program up and running as soon as possible in as many communities as possible. I want to thank the Governor and Lieutenant Governor for their leadership in making this a priority as we enter the second half of this school year. And I want to thank Commissioner Riley and his team, as well as Secretary Sutters and all the folks at DPH and the Command Center for making this day possible. I'll now turn the podium over to Commissioner of Elementary and Secondary Education, Jeff Riley, who will provide more details on the program.
Good afternoon. Thank you, Secretary Pizer, and thank you to Governor Baker, Lieutenant Governor Polito, and Secretary Sutters. By launching this new pool testing initiative, the Commonwealth is adding another important component to our COVID testing strategy in schools. Weekly pooled testing will be in addition to the Abbott BinaxNOW rapid tests currently used in schools to test symptomatic individuals, and the mobile rapid response units that are already deployed to schools when necessary. Pooled testing is not required to provide in-person learning. This is a voluntary program open to all public schools, districts, charters, special education collaboratives, and eventually private schools. School districts providing in-person or hybrid learning will be prioritized for testing kits, but schools in remote learning looking to bring students back to classrooms can also participate. DESE and HHS are finalizing a statewide contract that will enable schools and districts to work with testing service providers who will coordinate with the labs. Pooled tests will be analyzed at a local laboratory and results will be turned around quickly. DESE will assume the cost for testing during the startup phase of the program. We estimate this cost to be between $15 and $30 million. Following the initial launch, districts and schools may continue pooled testing by purchasing tests through a statewide contract that is being stood up using their federal stimulus dollars. DESE will be sending an overview of pooled testing to superintendents, charter leaders, collaborative executive directors, and approved special education leaders. This memo will include a link to our informational webinar that happens next Tuesday and a link to an interest survey. Using pooled testing with students and teachers, we will have one more tool to quickly identify infected individuals and their close contacts in school settings. There are a few school districts in the state that recently launched pooled testing, including Salem, Watertown, and Medford, and a few others are beginning soon as well. We are encouraged by the early results they are showing and by the information gathered from this method to help guide informed decision-making. Districts using pooled testing are seeing low positivity rates among students and staff within the schools. Watertown Superintendent Dee Dee Galston said it has allowed them to stay open despite the rising virus in their community. They have not had to think about closing their schools, she said. Since recently starting this initiative, Watertown Public Schools has tested more than 6,400 individuals, including students and staff members, and has seen a positivity rate of 0.21%. This is compared to the community rate of 4.4% as of December 31st. The superintendent told us what the testing is really helping to see is that the core mitigation strategies used in schools, masking in particular, are working. Pooled testing is an important development for our schools, and I just want to take a minute to thank my staff at DESE, particularly Senior Associate Commissioner Russell Johnson, who will be leading the initiative, along with Lauren Wu, as well as Secretary Sutters and her staff, who have all worked hard to make this possible in a very quick turnaround. Thank you, and now I'm going to introduce Secretary Sutters.
Governor, Lieutenant Governor, Secretary Pizer, Commissioner Riley, everyone, good afternoon. A little more detail about how, I'm going to go into a little more detail on how pooled testing works. We continue to carefully monitor the data around transmission in schools and believe that with proper mitigation strategies in place, transmission occurring within schools is rare, as you've heard from Commissioner Riley. We've seen others support this viewpoint as well. According to the December released Rockefeller Foundation report, and I quote, "There's been not a community outbreak traced to an elementary school, and contact tracing studies have found that children are almost never the source in infection clusters." That said, we know there are concerns, and they are high for some students and families, and we want every tool to prevent and detect spread. Now, as you've heard, we have a powerful new tool in our toolkit that didn't exist in the spring and was a concept at best this summer: pooled testing. New pooled testing, along with rapid point-of-care tests, the Abbott Binax Now, enable a shift to proactive surveillance testing models. Pooled testing allows low cost and greater expansion of COVID-19 testing. It is at least 75% less than the cost of an individual test. As Governor Baker said, we plan to build off the infrastructure of our successful rapid testing Binax Now program to support the range of tangible benefits that come with safe in-person instruction. We expect to accommodate all interested publicly funded schools during the 6-week initial launch, creating opportunity for many students in the Commonwealth without regard to grade level or geography. The pooled testing program that is launching will test students, teachers, and staff once per week. We will monitor the data and adjust as necessary. So what is it? Once schools go through the orientation and onboarding and the webinar that starts next week, that includes the training on procedures, protocols, and consent forms, they will be supplied with testing kits that contain all of the materials they need. The tests are short swabs that only go in the front part of the nose, completely painless, and I will avoid the description given to me by my staff. The swabs are collected and placed into a single tube to be transported or shipped to the laboratory. So if you think about it, 10 swabs in a tube. That is pooled testing. Schools will have a very simple technology provided by the testing services providers to track each tube containing the samples from a classroom cohort of students or staff. At the laboratory, technicians take all of the samples out of a tube and then combine them into a pool and run a single laboratory test to determine whether the pool is positive or negative. The results of each pool are reported securely back to the school, and we are planning for 24 to 48 hours after the samples arrive at the laboratory. If a pooled test result is negative, then all individuals within that pool are presumed negative and they remain in school. If a pooled test result is positive, then all the individuals in that pool are retested using the Abbott Binex Now, and the positive individual and any close contacts are isolated and quarantined. This allows classrooms to stay open. This approach increases the number of individuals that can be tested using the same amount of resources as a single PCR test. We realize schools need support in this endeavor, webinars, training staff, clear, understandable, and easy protocols, and assistance when issues arise. We are working with our pooled testing providers to provide these supports. Additionally, to help schools after the initial 6-week launch phase, the Commonwealth has centralized the procurement for pooled testing services and providers. Schools will be able to continue their testing programs after the launch phase by purchasing from a standardized state contract and prices. We are pleased at this next stage of providing pooled testing to keep or open our schools, but we know testing cannot eliminate the risks of infection entirely. This is one important tool in the entire toolkit. That's why it is critical to continue with the mitigation strategies we've been using since the spring. Wash your hands, wear face covering, keep your distance. We're excited to get pooled testing off the ground, learn as we go. Speed is the need, and lead the nation in working together to keep students in our classrooms safely or get them back to school. Thank you, and I'll turn it back to the governor.
So questions on this? And I may be leaning on these guys for that.
I think we all know that the teachers are really pushing back against in-person learning, and some of the towns, I think, are listening to their teachers, and they're going remote despite your assurances. So do you think this testing will help convince the teachers it's safe to go back?
I certainly think that one of the things people have talked about is some sort of monitoring program in place, although we would argue that the mitigation programs that are already in place have proven to be effective in every place they've been used. And we think this is, as we said, one more tool to encourage districts that are currently operating remotely to consider going hybrid or in person, and for those that are hybrid that would like to go in person, this is one more way they could do that and be pretty comfortable that on a pretty regular basis people were going to be tested. Do you want to speak at all to the teacher question, Jeff? Because I know you've had conversations with some of those folks.
So I guess what I would say is we've been in discussions with the American Federation of Teachers in the last few weeks, and there's a meeting that's going to take place next week where we plan to partner with them on this pooled testing. We do think it's important to their membership.
But would you agree that there's been a lot of pushback from the teachers, and that's been a stumbling block in getting this in-person learning going?
Yeah, I think there's been concern from the teachers' unions without question.
Will there be a sort of a push for these districts to come back to in-person or hybrid once this program is launched, similar to when you kind of sent the letters out in the beginning saying, what's your plan to come back?
So this is a voluntary program, but obviously it's going to be another kind of tool that people can use to make people feel comfortable about being in school. What I would say is between this and the vaccine that's on the horizon, better days are ahead.
And the governor had talked about private schools in parochial being so successful at using pretty strict protocols at a lot of Catholic schools. They don't do the weekly testing. How are they different? How will this help compared to what they're doing already that seems to be successful?
So we are going to be working with them to see how we can support them in this process, and we will continue to do so. We've been in touch with the private and parochial schools since the beginning. They've used a lot of our guidance to set up their classrooms.
I mean, why will this help more than what they're already doing, which is not the weekly testing?
You know,
Just so I can compare.
I think this is an additional tool in the toolkit. I mean, that's basically what it is. We recognize that there are people with concerns, and so whatever we can do to put out there to alleviate those concerns, that's what we want to do. Yeah.
Governor, could I ask you about something you announced yesterday, which is the change in the ratio of nurses at critical care units? Nurses union, I guess I'm the union question guy again, are really pushing back on this, saying that's dangerous to the standard of care. Are you concerned about that, even though we are in this pandemic and we need the beds?
So the policy that we put out through the Department of Public Health yesterday is actually a more narrow policy than the one we used last spring. And I actually should probably just let Secretary Sutter speak to this, because she's also had conversations with the folks at the M&A about it as well.
My earring is attached to my, sorry. So in the spring, we did a across-the-board relaxation of the ICU nurse staffing ratio, so all hospitals. And this time, it is much more tactical, which is only hospitals that hit certain constraints and have hospital capacity of less than 20% over for a 7-day period, and have eliminated all of their elective procedures that are on their hospital license, then they may relax, temporarily suspend the ICU nurse staffing. In the spring, it was across the board. They didn't have to hit those standards. And in the spring, it was safe. So we do this, with the understanding that it does stretch our nurses, and I have been back and forth with the M&A. And as we said yesterday, we know that it is our healthcare workers and our nurses in hospitals and other direct care staff that are bearing the burden of the disease in hospitals. So that's why when we announced this yesterday, it is much narrower than it was in the springtime.
So how would you respond when they say if a hospital can't handle their patients, they should transfer them to a hospital that can? Is that too simple?
So we are constrained across the state in terms of capacity, which is why, as you know, we have established the 2 medical field hospitals, the 2 alternative care sites, and we have asked them to double their capacity. We do expect transfers both within a hospital system, if you're a hospital system, and then if you're a freestanding community hospital, to transfer to patient load across hospitals, and then you would relax the nurse staffing ratios. So we did say in the attestation, every other reasonable measure should be taken before you do this.
Secretary, has there any hospitals applied yet for this? And if the cap is lifted, how many patients might an ICU be treating it? Is there any limit?
So the ICU nurse staffing mandate is 1-to-1 or 1-to-2, depending on the acuity of the patient. So obviously, if you were like 1-to-2 or 1-to-3, that would be able to add physical capacity. We don't mandate what that should look like, because obviously every hospital and the configuration of the space is different in what space they're using for surge. So so my information is as of yesterday, when it went live, was not. We had not yet seen an attestation.
Secretary, on the issue of vaccine.
I'm sorry.
I just wanted to ask you about vaccine rollout. Do you feel you have the tools you need to get these shots in people's arms for the next phases? Do you need more sites?
So, I'm very pleased. I can't remember what this week when we said we had 60 vaccination sites set up for our, was that two? Thank you, sorry. For our first responders. We have now more than 115. We have 119 sites as of today for our first responder community starting on Monday, which we feel very good about. And we are literally trying to get, the ink on the paper of the contract so that we can announce the mass vaccination sites. So we are feeling that we are starting our first responder vaccination program strong. If you've gone on the website, the appointments are being made. So we feel good about that. The federal pharmacy partnership is going well. So as of today, 317 of the 379 skilled nursing facilities in Massachusetts have been scheduled through today. So that's about 80, I can't do the math off the top of my head, it's probably about 85% of our skilled nursing facilities. And the federal partnership will start to roll out Monday for, as the governor said, HUD 202s, continuing care, rest homes, assisted living. So that is, I think and looking at the camera, what I'd say is we are distributing the vaccinations. We need folks to be willing to accept them. So we have the vaccinators. We have distributed everything that has come into Massachusetts to providers, and the difference between administered and shipped, one is the delay in what is reported to the MIIS, and the other is the individuals' willingness to accept the vaccines.
Some states are sticking too closely to he said the state should not leave vaccine in the freezer if there are other people that are willing to be vaccinated. Is Massachusetts, are we willing to be flexible with who gets the vaccine?
We accepted the recommendations of the Vaccine Advisory Committee, as you know, and we clarified for individuals who are 75 and plus. We continue to flex. We have said, in fact, there's a bulletin today that says to providers, if you have vaccines in your hands right now, please use them within for the phase 1 categories. So we are trying to get the message out that this is not the entire population of the Commonwealth of Massachusetts, because it's very important that we roll this out right. Healthcare, we need to preserve. Let's remember what the 3 goals are of our vaccine program. One is to preserve our healthcare system. Very, very important as we're in the surge, and we've been talking about that. The second is to mitigate mortality. Can't reverse death. And the third is equity. So we believe phase 1, if right now there are hospitals and other entities have vaccines, to continue to move through the phase 1 categories.
With more sites, and President-elect said that his goal is to get more vaccines out, maybe even all of it. Would that impact our timeline?
Well, we look forward to, we've heard the media reports of the incoming administration, and we look forward to hearing more about what President-elect Biden's, when he's president, what the plans are for vaccines. As we have said, vaccines can't come soon enough into the Commonwealth of Massachusetts.
Secretary or the governor, have you considered using the National Guard for either vaccinations or testing at this point? Is there a manpower issue that they could be helpful?
Since you said my name first, then I'll hand it over. So we are using the medical side of the National Guard really to help support the needs of our skilled nursing facilities. So as you know, we have these rapid response teams in skilled nursing facilities, and half of the 24 teams are our medical National Guard. And we think that is a very important use of the National Guard, which is to support skilled nursing facilities as they have clusters and staff are out as a result. And we think that right now, at this time, that is a very prudent use of the medical side of our National Guard. Governor?
Governor, I get your reaction.
This week, just to revisit something from earlier this week, you had made a change with the board of the Holy Soldiers Home. Families, they're wondering if you're ever going to install a family seat on the board of that home. They're obviously very interested, and they're also wondering when you will visit the home. You were out in Western Massachusetts earlier this week, didn't make a stop. That's what they're wondering. What do you have to say to that?
So I think I told everybody here back in the spring that I called 100 families that lost somebody during the COVID tragedy that took place at the Holyoke Soldiers Home, and I actually talked to 80 of them. That took place over about a 2-week period, and I spent somewhere between 20 and 30 hours on the phone, one-on-one with these folks, because I didn't know a way to put that many people in one place in the midst of a pandemic, but I felt it was important for me to speak to as many of them myself personally as I possibly could. The other concern I had was sometimes when you put a big group together, 5 or 6 people have a lot to say, and the other 75 don't feel like they can get a word in edgewise, and I wanted to give everybody who wanted a chance to speak to me the opportunity to do that personally and directly. With respect to the board, there is not currently an open seat on the board. We have filled the seats that were available based on the current rules associated with the skill sets and the geography that are associated with who should be on the board. The legislature, I think as most people know, had a series of hearings about the tragedy that took place at Holyoke and said they would make recommendations at some point during, I think their report's due in March of 2021 with respect to what they think governance and other operations and other issues like that should look like going forward. I would assume that part of that conversation will include whether or not there should be a family representative on the board and how that should be defined. If that were to happen, obviously that's something we would support.
Governor, what is the state doing with this more contagious virus that's out there? It's been detected in New York, Connecticut, getting closer. What specifically is the state doing in preparation for that?
Well, we're doing, first of all, this remains your best protection with respect to any strain of COVID, including the new one. All right, people should remember that. And that's in formal and informal settings. And it's especially true whenever you're not in what we have described here as your immediate household bubble. We are currently testing, along with some of our colleagues in the lab community here, tests to determine if in fact the strain exists in any of the testing that we're doing. We're sampling, and we're also sending samples to the CDC, and obviously we're also talking to our colleagues in other states. But the big message I would deliver around the new strain is, whether we have actually found it or not, it is probably here. And I said that when I was out at Bay State on Tuesday, because if you're talking about a really significantly more contagious strain of COVID, it may start as a relatively rare variant, but it will grow quickly because it is in fact more contagious than the strains we've seen previously.
Does this strain have the potential to push the state's healthcare system over the edge?
I think if people continue to do the things we've asked people to do, and most people have done quite successfully for the better part of the past 10 months, which is to wear masks, avoid gatherings, keep your guard up, especially when you're in informal settings, wash your hands, maintain distance. I mean, all those things are protection against the new strain, the old strain, all of it. And I think it's critically important, even with the vaccine on the horizon and becoming part of the picture here, for people to continue to recognize and understand that. And I go back to the basic doubling of cases that we saw here in the Commonwealth after Thanksgiving. Most people, we believe, based on all the data we saw, did what we would describe as the probably unhappy but public health appropriate thing over the Thanksgiving holiday. Automobile traffic was down, bus and train traffic was down, airline traffic was down. We even checked out, what size turkeys people were buying, and it turned out that the big ones were still around on Thanksgiving Day and all the smaller ones had been sold. I mean, people for the most part appear to have done the right things. And yet, 7 days after Thanksgiving, we saw a significant doubling of sort of our daily case count. And in addition to that, the folks in the hospital world said to us that they literally saw that intergenerational transmission in terms of the age of the population that started showing up in the hospital. So my message on this is, I don't care what kind of strain it is. We'll figure out whether or not the new strain is here. But the most important thing I can say to everybody about COVID generally is it is very contagious. For many people, it can be a terrible burden and a potentially life-threatening illness. It gets passed by people who in many cases are asymptomatic or slightly symptomatic and may not even know they have it. And that's why, for your own sake and for the sake of the people that you're around, you should avoid gatherings, wear a mask, don't let your guard down, and unless you're with the people you live with, be very careful about the issues around distance and masking generally.
Governor, you
tweeted this morning that it is investigating the possibility.
Say what?
UMass Memorial tweeted this morning it is investigating the possibility that one or more of its employees was present at the Capitol on Wednesday, not necessarily charged, but present during the riot. What should be the bar for public workers in this state? If they were there, should it be criminal charges are filed, simply being present, and they also face employment sanctions?
Well, first of all, I've said this many times. There is nothing wrong, and there should be nothing wrong, with peacefully protesting any place, anywhere in America. I really want to make that clear. The problem is not about peaceful protest. The problem is about people who, for whatever reason, go way beyond the boundaries of what we would consider to be peaceful protest and engage in violent acts, or trespass, or break into a building, or vandalize someone's property. Now, when you have huge crowds, 5,000, 10,000, 20,000, 30,000, which many of us saw last summer and sort of starts to represent the size of the crowd that was in D.C. the other day, I think it's really important to separate the people who are there or who go there to engage in violent activity or to trespass or to break things that don't belong to them or to injure other people or to pick a fight versus the people who are there to protest or demonstrate about a cause they care about. Now, I've had people protest outside my house, which my neighbors just love, for the better part of the past 6 months, on almost a regular basis. And the vast majority of the people who've been engaged in this, and they're on all sides of all kinds of issues. You know, the only thing the people outside my house for the most part have in common is they're either there to peacefully protest or pick a fight. But in terms of the issue that they care about, or what side they're on, they've been all over the place. And I and others should have no problem, no matter what somebody's point of view is, if they engage in peaceful protest. And the opposite is true as well. If people engage in violence, and to me that includes throwing things through windows, or trying to trespass into areas that don't belong to you, on private or public property, defined as public in the sense of the Capitol building. And I've said this from the beginning, you should be arrested and prosecuted because you do damage to others for which you should not be allowed to hide underneath the umbrella of a peaceful gathering. And I find it fascinating that so many people, especially on social media, want to say certain kinds of protests on things they care about were obviously peaceful, and certain protests on sides they disagree with were not. When to me, when I look at both of them, I see the same thing. I see a bunch of people who showed up to peacefully protest and a bunch of people who showed up to cause trouble on both sides. Because I'm not looking at this anymore through the window of, left or right, or conservative or liberal. Because what I've seen going on outside my own house is protests involving all kinds of points of view with people who want to protest peacefully and people who are looking to cause trouble. So someone went there if some employee of ours, heck, we've had employees of ours who've been involved in a lot of these peaceful protests. I have no problem with that. None. But if you go there to cause trouble, pick a fight, engage in violence, break into a property that doesn't belong to you, you should be arrested and you should be prosecuted. And that's the way we should be thinking about this stuff. All of it.
Governor Westbrook sent out the news release this morning, the state did, the joint statement this morning about security around the State House. Do you have concerns about unrest moving in this direction?
I think the main reason that we wanted to put that statement out was we had had a lot of incoming, both from the media and from others, who had said to us, what's going on with respect to this building? And the answer is, there's a constant ongoing conversation between the House and the Senate and our administration and folks in law enforcement and the security teams about the security of this building and this property. And we pay a lot of attention to what information our friends and colleagues in the public sector are picking up, especially in the law enforcement community, but also from other folks in municipal government and elsewhere who are just sort of tuning into what's going on in their communities about what's going on generally. And I think from our point of view, intelligence gathering and being prepared is a much better strategy than any other. And that is the one that we have used since, the start of a lot of this back in the spring. And that's going to continue to be the strategy that we take.
Governor, can I quickly get your reaction to the record cases we saw yesterday, more than 7,000, and whether or not you think an additional field hospital would be necessary? Mayor Walsh talked about standing up Boston Hope again.
So we still have a fair amount of capacity in our existing field hospitals, and I think the one thing I would say about the case counts generally is goal number one, pay attention to the case counts. Goal number two, pay attention to the nature of who's in those case counts. One of the things that happened after Thanksgiving was, for the first time, and I said this, we saw a change in the distribution of cases between the age groups, right? For the first time, the 50 to 59 group had more people in it over the previous 14 days than the 40 to 49 group. That hadn't happened at all since the fall. And I think one of the things we try and pay attention to through our conversations with our colleagues in the healthcare world is not only what are you seeing, but how are you modeling this stuff, and how are you thinking about what's coming in the front door, and who you're taking care of, and how severe are they, and how you're feeling about things. And that's the way we're going to continue to manage this, based on the dialogue and the conversation we have with them. But based on the conversations that we had this week, and we had several, I think we all believe that our first focus should be on using the sites that we've got, and then working with our colleagues to make sure that they aren't doing a lot of the elective stuff that is not emergent and could be postponed for some period of time, and making sure that we have beds available for folks who are dealing with COVID and emergency situations right now. But the modeling on this, the one thing all of these folks have said to us is, if you go out more than maybe 10 or 14 days on the modeling, whatever you're using with respect to how you're thinking about case counts and all the rest, the gap with respect to what the answer is going to be when you get there, how you're going to project that, the gap is going to be so wide as to almost be not helpful. And so our primary, Terry I think wants me out of here, so I think our primary way of thinking about this is on what I would describe as sort of, that 10-day or 2-week period. And with respect to that, if people do the right things, and I keep coming back to that, if people do the right things here in the Commonwealth, I think we believe we don't need another field hospital at this time. Thanks.
Good weekend.
Have a nice weekend, guys.
Thanks.